Hello to those that have joined us online already. We're just waiting for one more minute for everyone else to be able to come online, and then we'll get started. Hello, everyone. A very warm welcome to the Road Safety Capacity Building Program Webinar Series 1 that is brought to you by the Asia Pacific Road Safety Observatory, the APRSO, and the Central Asia Regional Economic Cooperation CAREC program and the Asian Development Bank. And we also gratefully acknowledge the grant funding that is supporting this series, which was received from the Japan Fund for Poverty Reduction, financed by the Government of Japan through the Asian Development Bank. My name is Jessica Trung, and I'm from a company called Lersninger, and we specialize in Vision Zero planning. And I will be your moderator today. So a very warm welcome, and we're very glad that you can join us today. So this webinar series has been designed to help engage a range of stakeholders to help you build capacity and build understanding around how to apply the safe system approach to road safety strategy, development, and interventions. As you are all aware, we are now in the midterm of the UN Decade of Road Action for Road Safety. And as a matter of fact, a couple of weeks ago, there was a midterm review to see how we're progressing towards the target of a 50% reduction in fatalities and injuries by 2030. So that took place during the 4th Global Ministerial Conference on Road Safety in Marrakesh a few weeks back. And I think one of the key takeaways was that we need more actions in order to help us reach that 50% reduction. So while we've seen some progress, there's still a lot of work that needs to be done if we want to reach that target. So we're hoping this series will help provide some strategies and opportunities to be able to share global and regional best practice and highlight specific examples of interventions and actions that member countries and stakeholders might be able to take away to help with their everyday road safety work. And we're also hoping this will be a great opportunity to be able to connect with other global, regional, and national experts to help understand what can be directly applied to enhance policy, investment, and implementation of road safety in your country. So today is the first of a series of sessions that we'll be rolling out in the next couple of months. And in today's session, we'll be focusing on an overview of the global status reports and the types of data that's included, and then how they can be utilized for road safety planning and implementation. So in today's session, we have a number of fantastic speakers that are joining us. If we can move to the next slide, please. And our speakers include Priti Gautam, who's the Senior Transport Specialist and Road Safety Lead with ADB. Welcome, Priti. We also have Sushil Dakal, who's the Joint Secretary from the Ministry of Physical Infrastructure and Transport in Nepal, and he is also the Chair of the APRSO. Thanks for joining us, Sushil. And then we also have Kiko Takahashi, who's the Alternate Executive Director of Japan. Welcome, Kiko. And then we've got Fang Dan, who's the Technical Officer from the WHO. And then we have Abdul Bachani, the Director of Johns Hopkins University. So welcome, Fang Dan and Abdul. So we've got a great lineup of speakers today who you will be able to hear from in turn. And we will also be holding a Q&A session at the end. So please do get your questions ready. We want to hear from you. We want this to be an opportunity to be able to exchange ideas. So there is a Q&A button at the bottom of your screen. So please do feel free to utilize that. And I should also mention that this webinar will be translated from English to Russian. So there is an option at the bottom to select the Russian translation if you haven't already. And then if we move to the next slide, as I mentioned earlier, this is one of a series of sessions that will be coming up. We'll be running a series of sessions every second Tuesday until May, and every session will focus on a slightly different topic. So today you'll hear from our speakers on the WHO Global Status Report. In the next session on the 25th of March, you'll hear about what other complementary data and resources are available globally, which can complement the data that is available in the status report as a part of your road safety planning. And then when we move to the 8th of April, we'll hear more about how can we use these data sources for effective strategy planning. And then on the 22nd of April, we've also got a session. Okay, we've developed the strategy. We need to make sure we've got some key performance indicators and safety performance indicators to ensure that we're actually tracking our progress towards our targets of 2030 and 2050. And then finally, on the 6th of May, we've got a final session that will sort of bring all the topics together and for us to discuss how do we actually communicate and finance these road safety ideas and strategies that we've developed. So we've got a whole host of different speakers with different expertise that will be joining us throughout this webinar series, and more speakers will be added in the following weeks as well. So we would really appreciate if you could join us for the whole series, and I would strongly encourage you to actually attend all of them. And then if we move to the next slide then, please. Just a couple of very quick housekeeping rules before we move into the main presentations. Your microphone will be muted unless you are invited to speak. And as mentioned earlier, there is a Q&A button at the bottom of your Zoom screen. So if you would like to ask a question to any of the speakers, please feel free to use that function to record your question. I will be monitoring it throughout the session, and we'll be taking some of these questions to the speakers during our Q&A session at the end. But during the Q&A session, if you would prefer to actually ask a question in person, please do feel free as well. Raise your hand and hopefully I'll be able to see it, and you'll be able to ask your question either in English or Russian, as we've got translation today. So that's really it for the housekeeping. Thank you for joining us, and I really hope you enjoy the session. And we're going to move into introducing our very first speaker of the day. So we move to the next slide. First up, I would like to introduce Priti, who you've already met, who's the Senior Transport Specialist and Road Safety Lead with ADB. Thank you, Priti. The floor is yours.
Thank you, Jessica. Can you hear me okay? Great. Good afternoon, everyone from Manila. Thank you all for joining us for the first webinar of our 2025 Road Safety Capacity Building Program. And as mentioned earlier, it's brought to you by a collaboration of the Asia Pacific Road Safety Observatory, the Central Asia Regional Economic Corporation, CAREC program, the Asian Development Bank, and we would also like to thank the government of Japan, who today is represented by Ms. Keiko Takahashi, for being a great partner in this initiative. ADB, or the Asian Development Bank, places high priority in contributing to a future. We want to see a future where there are no lives lost on the roads in the Asia and the Pacific. This commitment is reflected in our overall ADB strategy and also our transport strategy, meaning that road safety is systematically integrated into all of our related transport projects, infrastructure, urban transport, and also rail. We are aligned with the UN SDGs and Decade of Action for Road Safety Targets, which you all know quite well, aiming to have road deaths and injuries by 2020, and as well to provide safe, accessible, and sustainable transport to all by 2030. And we work on these targets at the global, regional, and national scale by strengthening policy, investment, and action, and by providing our member countries with operational financing, technical assistance, and grants, which we hope can make the connection between what we know works, the proven solutions, and the action that actually happens on the ground. At the recent ministerial conference on road safety that happened just a couple weeks ago that Jessica mentioned, ADB, along with other multilateral development banks, highlighted that there is an additional need for financing and funding for road safety that currently prevents action in low and middle income countries. And to address this, ADB announced at the conference its pledge to make available to requesting member countries 2.3 billion over the next decade for road safety activities. So this means we'll continue to deliver financing and technical support to our members. And we're committed to promoting the safe systems approach, also in road safety management, achieving road safety outcomes in our relevant projects, which I mentioned earlier, strengthening capacity at the national and regional level, and also through initiatives like these. We'll continue to develop procedures, guidelines, tools, and studies that inform action on the ground. We're also supporting sub-regional road safety initiatives like CAREC, SASEC, and ASEAN, and importantly, supporting the Asia Pacific Road Safety Observatory, which is hosted at the ADB, and the chair of the observatory, Mr. Sushil Dakal of Nepal, will share more about the observatory shortly. And despite all of this commitment and ongoing work, you will see through this webinar series that we still have a lot to do. And we've seen some improvements, but there are still significant challenges in our region, which accounts for nearly 60% of global fatalities and injuries. Additionally, in the region, we observe the highest usage of power two-wheelers and a corresponding share of fatalities and injuries. And at the same time, we're seeing a continuous change in our mobility and transport landscape. For example, a notable shift to more climate-friendly modes of mobility and transport. Some manufacturers, for example, have announced plans to electrify their four-wheel vehicles by 2030. So this underscores the importance of us continuing to monitor emerging trends and collecting relevant data as our landscape regionally, nationally, and globally changes. So this brings us to the significance of this webinar series. We at the ADB are excited to collaborate with the Observatory CAREC program in Japan to provide an opportunity for knowledge sharing amongst our members and stakeholders. So thank you again for being here. In terms of the topic of the series, and this one in particular that we're starting with on data, ADB is not only committed to strengthening national crash databases, we focus a lot on fatalities and injuries, but we also encourage the support of granular analysis of road safety data at the local level, including safety and performance indicators, risk factors, traffic and mobility patterns, road user behaviors, infrastructure assessments, and so forth, which we believe are just as important as crash data, and sometimes easier to collect and can give us precise and informed decisions at the localized levels. We also have new technology available to us, AI tools, which we're also looking at to help bridge the gaps in available data, which you'll hear more about in the subsequent sessions. So looking ahead, as Jessica mentioned, this is the first of a year-long of a capacity building series that we are planning. This one is focused on data. The next one will be focused on road safety as part of livable and resilient communities. And as we head to the end of the year, we'll focus on strategies for diversifying funding and financing for road safety. And so we hope you enjoy these series. And to conclude, I want to emphasize that we at the ADB are dedicated to collaborating with all members and partners and translating capacity building initiatives like this one into real action and projects on the ground. So please reach out to us, and we're really eager to work together. Thank you again, and we hope you enjoy the series. Over to you, Jess.
Thank you so much, Pretty, for your welcoming remarks, and thank you so much for your support with this series. And it sounds like there will be a lot of interesting series following this one that others can look forward to as well. So thank you. Fantastic. If we move to the next slide, we'll also like to welcome our next speaker, who is Sushil Dakal, who's the Joint Secretary from the Ministry of Physical Infrastructure and Transport of Nepal and the Chair of APRSO. Sushil, the floor is yours to provide some welcoming remarks.
Okay, thank you, Jessica. Good afternoon, everybody. I'm from Nepal. Distinguished guest, colleagues, and participants. It is my honor to welcome all of you in this Road Safety Capacity Building Program webinar, Data in Action using global and local data sources to enhance policy, investment, and implementation. Today, we focus on an overview of the WHO Global Status Report 2023. I am Sushil Babu Dakar. I am thrilled to see such a committed audience. Road safety remains a critical global challenge, and the WHO Global Status Report 2023 serves as both roadmap and a reality check. It highlights the urgent need for data-driven action to achieve the global target of reducing road traffic, death, and injuries 50% by 2030. I thank APRSO, Asia Pacific Road Safety Observatory, Asian Development Bank, and the CAREC for organizing this webinar, which reinforces our commitment to CAREC declaration from the 4th Global Ministerial Road Safety Conference just happened in February 2025. I would like to thank the government of Japan for the necessary support. Global Status Report of WHO revealed some key data which demands the attention of the world. Road crashes are the leading cause of the death for children and youth aged 5 to 29. Two-thirds of the fatalities occur among the people aged 18 to 59 years, causing significant economic and social harm. Motorcyclists and the riders of the 2-3-wheelers account for 30% death, pedestrians for 21%, and cyclists for 5%. Southeast Asia accounts for 28% of the global death, and the Western Pacific for 25%. Only 7 countries have WHO best practice laws on the speeding, drink driving, helmet, seatbelts, and child restraints. 92% of death occur in low and middle income countries, with the risk of death 3 times higher in the low income countries, despite having fewer than 1% of global vehicles. These numbers represent lives lost, families shattered, and economic burdened, but they also represent an opportunity. Data is our most powerful tool to guide the policy, allocate resources, and design safer system. As road safety is not only national issue, it is regional as well as global issue. It demands regional collaboration. This what one of the key message the CAREC Declaration on the Road Safety. In this context, I am using this opportunity to say about APRSO, its role in addressing these challenges. APRSO is established in 2020 and is a leading regional forum for road safety with 27 countries as a member. We foster collaboration among governments, international organizations, research institutions, and private sectors. Our work focuses on 3 core strategies: strengthening data system to improve monitoring and reporting, building capacity and providing technical assistance to inform practices, leveraging transport investment to enhance road safety. In the meantime, APRSO developed common indicators for monitoring and improving data system. It created national road safety profiles in collaboration with Asian Transport Outlook. It contributed key data to the WHO Global Status Report 2023. It trained over 1,500 stakeholders through capacity building programs. And it supported initiatives like study tours, including recent programs in Japan. There are some ongoing initiatives by APRSO, conducting crash data reviews in Fiji, Papua New Guinea, and Armenia, developing data-driven policies, focusing on power two-wheeler safety, studying safety performance indicators using geospatial analysis and private sector data in India, Philippines, Vietnam, Thailand, and Malaysia, identifying road safety gaps through safe system assessment in Fiji, Papua New Guinea, and Armenia. APRSO has some future plans also, strengthening support to reduce road crash fatalities, scaling of capacity building and technical assistance, developing regional roadmaps aligned with global best practices, embracing the emerging technology like AI and geospatial tools, facilitating financing pathways for critical interventions. Again, I am using this forum. I like to call action to countries not as a part of the APRSO I extend a direct invitation to join us, share your best practices, and let's work together to ensure every decision is backed with solid evidences. Road safety is not about competition, it is about collaboration. By joining APRSO, you are not just collecting data, you are shaping policies that will protect millions. You are building safer future for our region. Finally, I'm happy that this webinar series highlights APRS's role as a key regional focal point for the road safety. I encourage all of you to participate actively and use the insights gained to strengthen the road safety in your own countries. Thank you very much. Again, I like to welcome. Thank you very much.
Thank you very much, Sushil, for your remarks. I really like what you just said around let's work together. It's about collaboration and not competition. I think that's very well said, and within the spirit of what this webinar series is all about. Let's share information, let's collaborate and work towards helping each other achieve our respective goals in the lead up to 2030. So thank you very much for that, Sushil. So if we can just bring up the next slide, and so we can welcome our next speaker, Kiko Takahashi, who's the alternate director of Japan. Coco, this floor is yours to provide your welcoming remarks. Thank you.
Thank you, Jessica. Can you hear me? Well,
Yes.
okay, thank you so much. Good afternoon, maybe good morning, and maybe for people who are joining from different time zones, already inspired by previous speakers, I'm very pleased to join this webinar program. And firstly, let me thank the organizers, including ADB transport team, in collaboration CAREC and APRSO, and for this opportunity for me to join this important webinar program. So I'm Keiko Takahashi, alternate executive director for Japan at the board of directors of ADB, so based in Manila. So I'm pleased that this road safety capacity building program webinar series is supported by Japan's bilateral fund, trust fund with ADB, renamed as the Japan Fund for Prosperous and Resilient Asia and the Pacific, in short, JFPR. So road safety is, since 2022, JFPR has 4 priorities on universal health coverage, climate change and disaster risk management, and quality infrastructure investment and public financial management. So road safety is critically important for people to live and prosper in safety and to promote economic activities. So I once worked on budget for national police agencies in Japan when I was working for Minister of Finance, so I clearly understand the importance of road safety. So road safety is therefore recognized as a critical area of focus for JFPR, given its relevance across the 4 priority areas, as I mentioned. So indeed, the government of Japan set the tone for its international support for road safety at the 2022 UN high-level meeting on improving global road safety in New York. The ambassador of the permanent mission of Japan to the United Nations stated that Japan remains steadfast in its contribution to the achievement of the goals set forth in the second decade of action for road safety through international cooperation based on Japan's knowledge and experience. Against this background, we saw the critical need for our support for accelerating road safety performance across Asia and the Pacific to address the social and economic impacts of death and injury from traffic cases. Japan's value addition in this endeavor rests on the nation's exceptional management of road safety over many decades and the importance of leading similar change across the developing countries in the region. At 2.7 road fatalities per 100,000 population, Japan's roads are already among the safest in the world. In addition, Japan and ADB's trusted working relationship across the region means that it is uniquely positioned to convene and support activities of Asia Pacific Road Safety Observatory, APRSO. So as a result, and as part of our efforts to realize reductions in road deaths, JFPR is providing strong support to the APRSO. This support is purposefully designed to enable APRSO to provide much needed support to developing member countries to collect and use data, plan, implement, and monitor effective responses to road crash deaths and injury. To achieve this, JFPR is closely supporting APRSO through a range of key activities, including providing DMCs, developing member countries, with best practices road safety knowledge curated for Asia and the Pacific, country road safety management improvement, data collection and reporting enhancement, innovation and skills building, and to ensure that the observatory is providing the logistics and the support needed to deliver effective services to enhance road safety management capacity. In addition, JFPR is facilitating key collaboration between the APRSO members and leading government agencies, research institutions, and private sector partners from Japan so that expertise can be collated and shared throughout the region. A strong example of this was the 2024 APRSO Annual General Meeting and the Study Tour, which representatives from more than 20 countries across Asia and the Pacific joined. It was a great opportunity for APRSO members to engage directly with leading Japanese experts in Tokyo and Utsunomiya. This event proved a strong success and a great model for sustained engagement and collaboration moving forward. Finally, I would like to acknowledge the importance of this webinar series in the continued provision of best practices to APRSO member countries and stakeholders. In particular, I'm pleased to see that one of our leading agencies, ITALDA, will also contribute, and I'm sure that their contribution, along with all of those from an outstanding range of global and regional experts, will be incredibly useful for all participants. So I wish you well for this session and the continuing webinar series. Thank you very much.
Thank you so much for your welcoming remarks, Kiko. And thank you for your support of this webinar series. And I really liked what you said about road safety being necessary in order for people to prosper. We can't really expect people to go about their everyday lives and move around if they don't feel safe. And that's why road safety is a necessary addition to our public health agenda to ensure everyone is able to move about safely. Thank you for your contribution, Kiko. Fantastic. We can bring up the next slide. We're ready to welcome our next presenter, who is Fang Dan, a technical officer at the WHO, who will share a little bit with us regarding how the history around the WHO global status reports came about. So really looking forward to your presentation, Fang Dan. The floor is yours.
Pull up my slides.
Yeah.
Can you see my slides?
Not just yet.
Can you see it now?
I can see it starting now.
Okay.
And yes, fantastic. We can see it now. Thank you, Fang Dan.
Thank you, Jessica. So as today's topic is the Global Status Report 2023 for planning, let me start by giving a bit of history and the process how we got this global report. So, so the 2023 Global Status Report is an overview of the global situation using the 2021 data from the member states. And it also accommodates legislation information that got implemented by end of 2022. And its function, in general, all these global status reports we produced so far, 5 global reports and 1 world report. The purpose is to monitor the progress of global efforts to improve road safety, especially as a monitoring tool for the first and the second decade of action for road safety. And this 2023 report especially functions as a baseline for the new decade of action covering 2021 to 2030 towards to inform interventions to enable us to achieve the SDG 3.6. So this global report actually is a product of a 2-year process using a standard questionnaire with contributions from across the world. The standard questionnaire, so WHO uses a standard questionnaire to collect data from all the member states, and it covers 87 questions in 14 sections, including road safety death and non-fatal injuries, strategies and targets, information system, exposure to risks, infrastructure, vehicles, insurance, speed control, impaired driving, use of protective devices, post-crash response, and governance and financing. So we involve thousands of people across the world. So at WHO, the 3 levels of WHO are all actively involved in this process, from headquarters to regional office and country office. We designate a regional data focal point for all the 6 regions who will coordinate the project in the region. So, and at country level, we work closely with the government, including 1 national data focal point identified by the government and multiple national data contributors from various sectors, including vital registration, house, transport, infrastructure, interior, vehicle, commerce, finance, and NGOs and academia. So, as I mentioned, it's a 2-year process. Pardon this very complicated diagram. The process takes 2 years. So the first step is WHO would reach out to the governments of countries for a nomination of the national data focal point. After this person is identified by the government, he or she would receive online training by WHO regional data focal point, and then develop a detailed work plan with timeline and deliverables. And then this national data focal point would work with WHO and identify the national data contributors from various sectors, because as you see, the questionnaire includes questions from many aspects. So one person, it will be impossible for one person to complete the questionnaire. And then after identifying these national data contributors from various sectors, they would each get a briefing about the process, the questionnaire, and then they will respond to the questionnaires, especially the questions fall into their technical areas. And for questions, for example, do you have this policy, or do you have this legislation, do you have this practice? If they answer yes, then they should also provide the supporting documents. After the various, the national data contributors each completed their sessions, there will be a consensus meeting held where the national data focal point, the 1 person, and many national data contributors with support of WHO will go through the entire questionnaire and agree on the response to each of the questions and make sure all the supporting documents are included, and then they would complete the final questionnaire. then it will be the NDFP National Data Focal Point's role to submit the questionnaires online to WHO, and then WHO would validate the information submitted to see whether all questions are answered, or to see whether the supporting documents are provided, whether they're matching with the question they respond, so on and so forth. If there's any issue, then the WHO would ask the National Data Focal Point to complete to provide additional information or correct. So this is a back and forth process. After all the questions are properly responded, or the supporting documents are accepted, then the WHO would summarize all the data submitted by country and develop a sign-off sheet and send to the National Data Focal Point. And then the National Data Focal Point, after receiving both the completed questionnaire and the sign-off sheet, would reach out to the authorities for their confirmation and government clearance. And then the government would approve the data submitted and sign off on the sheet. And that's how, that's the entire data collection process. After this, it will be the role of data analysis and writing the report and so on. So basically, this is the process for data collection. It's just part of the process of developing the entire report. And the report we're going to hear more from up to today is a report of 2023, which actually is not the first report. It's the 5th global status report on road safety. The previous ones were launched in 2018, 15, 13, and 2009. And before that, in 2004, there was a world report on road traffic injury and prevention. And that's actually more like a baseline of the global efforts to improve road safety. This is like a brief analysis of the coverage of this 6 reports. So here we can see all these 5 global status reports were participated by over 170 countries. And all of them cover over 96% of the world population. So developing the report is the purpose of doing that is to make it useful for the countries, for the partners who are working in road safety. So to make it more user-friendly, we have made the reports available in multiple languages. So you can see the summaries were available in almost all languages, all UN languages for 2023. And then the full report as well. And we also made the country and territory profiles starting to be included into the report for the first, second, and third, and fourth report included into the actual report. While for the 2023 global report, the country profiles were added as a separate part, not included into the main report, but they are all available online. So if you go to the WHO website, and then there's a place you can find all the country profiles. And in addition to 2023, we're actually uploading the country profiles from previous reports again separately into that link to make it more user-friendly. And since the report 2018, we developed a mobile app, which is an interactive mobile app. You can basically get access all the analysis and data, the country profile or regional analysis from this app. So it's downloadable from Google and App Stores. So this is a very brief introduction of how we made the global status report and how many we made. So since we already received so much data for the global report 2023, the Western Pacific Regional Office of WHO is also developing our regional status report on road safety. So it is estimated to be published in Q3 this year. So it includes more region-specific analysis, including the more common issues for our region, the priorities, or and country cases from our region for sharing experiences. So stay tuned for that. And with that, I hand over back to Jess.
Thank you so much for that, Fang Dan. I use the Global Status Report a lot in my everyday work, but I don't think I've ever thought about how much work actually went into the development of the report and how much time and effort and how many people came together to actually bring this wealth of information together in one report so that we can use it to help track our progress. So it was really insightful for me to actually understand a little bit about the history of how the Global Status Report actually came about. So thank you, Fang Dan, to you and your colleagues for bringing this great product to us. Thank you. And just a reminder to everyone as well, if you've got any questions for Fang Dan or any of our previous speakers, please do pop them into the Q&A chat box, and we will come to that at the Q&A session a little bit after Abdul's presentation. So with that, I'd like to introduce our next speaker. We've heard a little bit from Fang Dan about how the WHO status report actually came about and the amount of work that went into it. So now we would like to pass it on to Abdul, who is the director at the Johns Hopkins University, to speak a little bit about what is actually contained in the report and how we can use it to drive policy and action in our countries. Thank you very much, Abdul.
Thank you, Jess, and thank you to all the previous presenters for highlighting the significance of the report and how it can be used to enhance the road safety situation in many of our countries. And as Fang Dan pointed out, the report really is a monitoring tool. It helps us understand where we are, how much progress we've made, and what remains to be done, and has a lot of useful information that we can really utilize to drive action on the ground with respect to policy and programs in our respective countries. So what I'll do is just start with highlighting some metrics presented in the report that all of you have probably already seen. It's been said earlier today, and many times when you hear about the status of the field of road safety, that we still have an unacceptable number of people dying on our roads. We have, as of this report, 1.19 million people who are killed on the world's roads annually. While this is a 5% reduction since the first report was produced, it still remains unacceptably high. And it is young people, economically productive age groups, and young people who have the potential to contribute to our economies and societies who are most affected. So road traffic deaths, injuries are the #1 cause of death for individuals 5 to 29 years of age. And the majority of this burden is really concentrated in low and middle income countries. 92% of the deaths occur in low and middle income countries. And a concerning finding is emerging now as we have invested a lot in this area over the past couple of decades. Since the first World Report on Road Traffic Injuries that was produced in 2004, as Fang Dan pointed out, we're seeing that the deaths among four-wheeled vehicle occupants are falling. Based on this report, there was a 19% reduction among occupants of four-wheeled vehicles, but really a 30% increase among users of power two and three-wheelers. So 30% of deaths reported in this report are among power two and three-wheelers. and 21% deaths among pedestrians. So a significant burden among vulnerable road users, and that is a reflection of the design of our transport systems. And later on during this presentation, I'll come to how we can utilize this data to drive action. But again, the risk of death is significantly higher in low and middle income countries as compared to higher income countries. So 3 times higher risk of death if you're living in low and middle income countries as opposed to high income countries. So really an opportunity for us to reflect and see what it is that we can do and why this burden exists at such great scales in low income settings. The report has a lot of useful information, a lot of graphics, a lot of synthesized information that can be used. One such graph is this one that you've seen over and over again, representing the distribution of the burden across the different regions of the world, and how this burden is distributed among country income levels. So while the global number is 1.19, you can see here that this distribution varies, and the mix of road users affected varies as well, as we'll see. Now, there has been a shift in the way we use our roads over the years. It used to be that we had a lot of four-wheelers. This is changing. And the majority of the people identify now as either pedestrians and public transport users. But we know that only 47 countries have policies that promote walking, cycling, and public transport. So another key area for us to really focus in on. Again, here you can see a lot of road users are vulnerable road users, powered 2-, 3-wheelers, bicyclists, and pedestrians. So another area really that the report is drawing our attention to for focus. So what I want to do now is really get into how we utilize what's presented in this report to drive action on the ground, because really that's the crux of why these reports are produced. It's not just to highlight the burden and leave it at that. It's to drive action on the ground so that we can really improve the situation and prevent the unnecessary loss of lives on our roads. Firstly, as we've said before, the report is really a monitoring tool. It helps us monitor global progress, but also enables us to monitor how well we're doing in our countries, in our regions. So we are able to track trends in road safety globally. As I mentioned before, we're seeing that the global share of fatalities, for example, is shifting from four-wheeled vehicles to powered 2- and 3-wheelers, where we've seen an increase, 30% increase in deaths among powered 2- and 3-wheelers. It also allows us to compare across regions and within regions, across countries. And it's not just a matter of seeing how well we're doing with respect to the overall number of deaths, but also then helps us identify what it is that is different in countries that are doing better than others, and how we can then translate those learnings into countries that are faring a little less well off with respect to addressing this burden. It allows us to identify emerging trends, whether there's positive trends. The 5% reduction in overall number of deaths is positive, but certainly not enough, and more needs to be done. Or concerning trends where we're now seeing a lot of deaths among powered 2- and 3-wheelers and vulnerable road users. As well as it allows us to evaluate the progress of global road safety efforts. There has been a lot of investment in the area of global road safety over the past couple of decades, since the first report on road traffic injuries was produced in 2004. And we're starting to see some fruits of that labor, some fruits of that investment that have gone in. But we really need to do more. We really need to drive implementation. We really need to make sure we have a conducive policy and legislative environment on the ground to be able to really enhance what it is that we're able to do in our countries. The report is also an important tool for advocacy. It has synthesized information that we can use for advocating for better policies, for better programs, etc. It provides insights to guide legislation and policy making, whether it's focused on power two and three-wheelers, pedestrians, how we integrate and think about mobility in general as part of this sustainable mobility agenda and linking to other issues through the Sustainable Development Goals framework and other frameworks that exists. The report also highlights best practices for effective road safety measures. It allows us to see and has really good examples contained within the report on what has worked, what are some of these success stories, and how certain countries went about implementing this change so that we can learn from that and implement it in our own countries. There's also an important advocacy tool for understanding the discrepancies between country reported data and information. So the report, as Fang Dan pointed out, collects data from different countries based on the data that's available in these countries, and then utilizes a modeling approach to estimate what it is that the real estimate would be. It does then allow us to highlight areas for improvement and action, and I'm going to touch on that in a little bit later in this presentation. And also then, along those lines, allows us to mobilize action. What is it that we can do? And, for example, this webinar here, we're talking about the report and how we can use the report to mobilize action on the ground. We know that global and regional trends can drive local actions. It allows us to engage governments, stakeholders, and civil society in road safety initiatives. It keeps alive this global movement. It encourages international collaboration. It encourages cross-learning among regions, between countries, and enhances donor interest and funding in road safety programs as well. So it highlights the importance of addressing road safety and links road safety to different agendas, allowing donors to see how and where they fit in to finance specific initiatives that we may wish to undertake in our countries. The country-by-country situation highlights gaps for action. And as Fang Dan pointed out, each report comes with fact sheets for each country, providing a snapshot for where each country stands with respect to key specific areas of the safe systems approach for road safety, and really highlights what policy level gaps exist, what systems implementation level gaps exist, what data gaps may exist there, etc., to really drive action. So now moving into the third part of the presentation today is how we can then use what is contained in the report, what data is contained in the report, what information is contained in the report to drive policy and programs. So how can we use the report to really stimulate action? One of the things that is really important for us to do whenever we're thinking about translating data into action or galvanizing support around a certain issue is advocating for political commitment. Globally, road safety has received a lot of interest, a lot of prominence as compared to other areas of injuries. And now it's up to us to really translate that into country support for these initiatives. We know now, based on this report, the burden in each of our countries, what the legislation landscape is, what implementation is happening on the ground based on the safe system. And all this information combined together really allows us to align road safety with other national development goals. So it's up to us to really look at what the report has and align that and link it to other agenda items in our countries. And these may be different for different countries. We know now, based on this report, that 171 countries have a dedicated road safety agency, for example. And while 117 countries report having a national road safety strategy, only 16 of these strategies are fully funded. And that represents a gap. It is a gap. It's not enough to have a road safety agency, a road safety strategy. A road safety strategy developed and just sitting there will not do anyone any good. And so this report is really highlighting the fact that we really need to look at our road safety strategies and see whether they're fully funded, what aspects of those strategies are fully funded, and advocate for political commitment to seek more funding for those strategies and their implementation. Also, how they're funded, right? Whether they're funded through national taxes, through road levies, et cetera, et cetera. So really important for us to dig a little deeper into what the political commitment is and how then that translates to implementing road safety strategy and driving road safety action on the ground.
Sorry, Abdul, if you don't mind slowing down a little bit for our translators, that would be appreciated.
Sure. So one of the other areas that the report really highlights is the policy and legislative environment. We know that policy and legislative environment serves as the fabric on which programs are built. So, for example, we will not be able to enhance the use of child restraints if we don't have effective policies on the book or effective legislation on the books with respect to mandating child restraints. Standards for child restraints, for example, in our countries. And so without policy and legislation, all our other activities remain at risk. The report does a good job at highlighting some best practice policies for road safety. It also helps us to identify gaps in the policy, regulatory, and legislative environment. It provides us with a global snapshot of how many countries have effective legislations on the books. It also presents country-by-country scenario in the country fact sheets so that we can really understand where we are with respect to the policy, regulatory, and legislative environment in our country, what needs to be done that is not being done. We know that I highlighted earlier that while the majority of the people identify as pedestrians and public transport users, only 47 countries around the world have policies to promote walking, cycling, and use of public transport. And as Sushil highlighted earlier as well, only 35 countries around the world have legislation that is mandating all 5 core areas of vehicle safety equipment, while 79 countries have really no legislation on vehicle safety standards and other legislation as well. So here is an example of some of the graphics and figures that are available in the report. So for example, policies on vehicle safety, as I just highlighted, 35 countries have all 5 laws in place. And then we can also dig deeper and look at by different classes of vehicles, right? So national legislation on the 2 core powered 2- and 3-wheel safety elements. We can see that 68 countries out of 172 have either 1 or 2 of them. So daytime running lights and anti-lock brakes, for example, is represented on this chart on the right side of your screen. The report looks at different road safety risk factors and legislation. So 163 countries, for example, reported to have speed legislation. although only 58 met WHO best practice. And we can now disaggregate that as well. So, for example, 4 countries include an urban limit of 30 kilometers per hour or less. 9 include urban limits between 30 and 40 kilometers per hour. A total of 77 have urban limits of 50 or less. 63 countries allow local authorities to modify these limits. 56 countries include in the legislation a reference to speed cameras as an enforcement method. So all this really helps us understand what is this environment in our countries, where do these gaps exist, and how different our country legislation from the globally established best practice to allow us to identify those loopholes and really advocate for and drive action to change these policies to align with best practices, which will help us in turn achieve our goals for road safety. We can also look at helmet legislation, for example. 160 countries have national helmet legislation, but only 54 meet WHO best practice. Now, this is an improvement from the last report that was published in 2018. This is which had 49 countries that meet WHO best practices for adults. 13 countries indicate this applies to e-bikes, helmet use to e-bikes. So that is an area, again, as we are seeing an increase in the prevalence of e-bike use in many of our countries, especially in the Asia and the Pacific. This is an area that we really need to focus on to improve safety and to reduce deaths on the roads. So another area that is highlighted by the report and an area where action can be stimulated. We can also then look at infrastructure-related aspects, right? So we just discussed policy and legislative environment. But looking at infrastructure, we see that nearly 80% of the roads assessed do not meet a minimum 3-star rating for pedestrian or cyclist safety. And just 0.2% of roads globally have cycle lanes. So this is an area that is really lagging behind with respect to enhancing road safety. There really needs to be more of a focus on infrastructure and making our infrastructure safer and cities safer for all road users. And an area where we can really drive action through safer road designs, pedestrian-friendly urban planning. So really making sure that we're not designing our cities for 4-wheeled vehicles and motorized traffic, but that we're really designing our cities for everyone. And this fits in within multiple different sustainable development goals and multiple different agendas in different sectors. Sustainability, climate change, for example. We're seeing a modal shift, as I highlighted earlier. We're seeing more and more people who are saying they're either pedestrians, users of power 2-3-wheelers, or people who would like to use public transport. So we really need to also look at public transport safety and make that really more convenient for people to utilize and move people away from privately owned vehicles so that we can reduce motorized traffic on our roads and thereby enhance both safety on our roads as well as livability for our cities. Another area that I wanted to highlight that this report can really contribute to is improving data systems. Data is really a key element as we are thinking about designing and developing programs and implementing them. It allows us to understand where we are, what the gaps are, what needs to be focused on, and then how well we're doing with respect to addressing the issues we've identified. One important aspect that this report highlights is discrepancies between reported and modeled estimates. So, for example, there are discrepancies reported in 120 countries out of the 170 and 2 territories that are included in this report. And in some cases, the WHO estimates are 10 times higher than country-reported estimates. In one case, this is 49 times higher than self-reported figures. This is important in multiple different ways. It does highlight the need to strengthen data systems, but presenting the modeled estimates has had a side effect as well. It has stimulated discussions around data systems. It has stimulated discussions around road safety in many countries. And the importance of road safety data systems is not new to anyone who's listening in on this webinar. We know why we need to collect accurate and reliable data to understand the road safety challenges, to understand high-risk areas, to inform targeted interventions. We can use data for evidence-based decision-making and help us develop effective road safety strategies and get more bang for our buck. That is, get more value for every investment that we make to ensure our resources are allocated where they are most needed to save lives. It also helps us to monitor, evaluate what we're doing, how well we're doing it, and what adjustments we need to make along the way. So continuous assessment of road safety initiatives, allowing us to track progress and measuring the impact and adjust policies and programs to enhance their efficiency and effectiveness. It also highlights gaps in the kind of data that we're collecting. So, for example, looking at mobility patterns, we see that 34 countries out of the 172 included in this report collect information on usage of powered 2- and 3-wheelers. 11 countries collect information on time spent on the vehicle, distance traveled, and number of trips, whereas others collect the distance and number of trips. 5 collect time spent, 6 collect distance traveled, 8 collect information on number of trips. So really variation in the level of detail that is collected with respect to data on different aspects of road safety, highlighting some gaps and allowing us to really think about what we can do. The report has really good examples of data system strengthening. For example, there's really good information on a program in Zambia that focused on improving fatality data collection. But what this does, these discrepancies, while important, while it may seem alarming at first glance, have been really useful in getting stakeholders on the same table from different disciplines, different sectors in the country on what it is that we can do together. So there may seemingly be competing interests, but there's often a shared vision among stakeholders. So the transport sector, the health sector, just by the nature of the road safety problem, data for road safety comes from different places. It comes from police enforcement, it comes from the transport sector, it comes from the health sector, which it has information on injuries and deaths, as well as vital registration systems. Now, just by the nature of this layout of data collection and the different systems involved, there will be discrepancies. And highlighting these discrepancies has had the effect of bringing all these stakeholders on the table and seeing, okay, where is it that we have gaps, what it is that we can do to improve our data systems and fill these gaps in. But then that has then led to this discussion of, well, we're all here to make sure that people get from point A to point B safely. And how do we do that in a way that enhances safety? So there's then a better understanding of why these discrepancies exists. People have started to work together to improve data systems, enhancing interagency collaboration and building partnerships between governments, NGOs, and private sectors. So if you are from a country that has large discrepancies in data, it's an important opportunity and it's an important entry point that you can use to really bring different stakeholders on the table to first start a discussion on what are these gaps with the data, but then move this discussion on to what can we do about it and what can we really do about road safety and addressing some of the issues that are highlighted within the data that we are seeing. The report also helps us identify and address implementation gaps. It does highlight gaps in implementation. So while looking at the presence of legislation is good, that legislation will not have any impact if it's not implemented. Just the same as while having road safety strategies is a good first step. If they're not funded, financed, and implemented, then we won't see any results from that. And so the report does highlight areas for action. For example, road safety strategies that need to be funded, provides different examples of how road safety strategies have been funded, action has been funded. It also highlights important areas for action, for example, enforcement of legislation, that is implementation of that legislation, and highlights that there's variability in law enforcement across countries, and an area that we also really need to focus on to drive action on the ground. So looking at enforcement systems, for example, whether there's a ticketing system in place, how that system operates, what are the gaps in that system, and help countries really improve on this and enhance the implementation of legislation and address gaps.
Abdul, just a couple of minutes left.
Sure.
Just one more minute. Thanks.
Yes. So different strategies to close implementation gaps is one, we can work on strengthening institutional capacity. We can then also work on enhancing individual capacity, on utilizing data, on how we can then think about resource allocation to make to get the most out of our investments, how we can better monitor our progress and use data to inform what it is that we do and adjust course as needed. And lead change on the ground. So different areas where we can strengthen capacity at the individual level, but also thinking at institutional capacity strengthening. So just to end with a summary, the Global Status Report on Road Safety, as we heard from Fang Dang, is published every few years. It does do a really good job and helps us track our progress in the field of road safety. Tracking performance towards our targets, looking at trends, what has worked, what doesn't work, and includes important case studies from country examples of what can be done. It does present status on key issues by countries and highlights policy, regulatory, and implementation gaps that can help us to galvanize action. And information from this report can really be used in a number of different ways to drive local action, to galvanize political support, to look at strengthening policy, regulatory, and legislative environment, to look at infrastructure improvements and what can be done for different road users, looking at data system strengthening as an entry point towards starting broader discussions for engaging stakeholders and strengthening implementation. Thank you. And with that, I will hand it back over to you, Jess.
Fantastic. Thank you so much, Abdul, for that really insightful and interesting presentation. I think it's been a really good deep dive into what some of the data in which the report holds, but also more importantly, how it can be used to help drive some changes that we want to see on the ground. So now if we can just ask all the speakers to come back online, we're going to start our question and answer session now. And I can see that everyone has come alive and that the Q&A box has been a humdrum of activity. So there's lots of questions coming through now. So we'll try to answer as many of them as possible. First one I would like to maybe direct to Fang Dan. I know you've sort of touched on this in your response on the Q&A section already, but it might be good to highlight it for everyone else that might not have seen it. So the question was around, I think you mentioned in the WHO app that it contains some original analysis. Can you maybe give some details on what those analyses are?
So I actually have this app open on my phone. So if you go to this, there's a function, one of the 6 main functions called regions and my groups. So you actually can choose one WHO region, one of the 6 regions, or you can create your own group by selecting countries. And then if you go to, after you selecting the countries, creating your own group, then it provides data on the total population, total number of vehicles and burden, and then the status of safe road infrastructure, safe vehicle, post-crash response, institutional framework, road user behaviors that's related to legislation status, and national data systems. So it's pretty. It's a bit similar to the country profile page, but you can choose to group countries or choose a region. So it provides the collective data of that group of countries.
Fantastic. Thank you so much for that, Fang Dan. I might just throw it to Abdul for a second. And actually, Fang Dan, this question is also relevant for you. I think there's a number of questions in the chat group talking about the underreporting and the data discrepancy that we're sort of seeing between what WHO is reporting and also what in countries are providing. Would you be able, either of you and both of you can comment on why there are discrepancies between the two and how that's sort of adjusted for in the WHO report? Maybe we'll start with you, Abdul.
Sure. I'll start, and Fang Dan can chime in as well. The report has a detailed annex on the methodology applied and the modeling that is used. So I will not get into those details. However, it is important, as I briefly touched upon during my presentation, to understand how road safety data is collected and where it is collected in countries. We know that a lot of our countries have weak data systems, and that is a reflection of multiple things. It is a reflection of one, political commitment. It is a reflection of the amount of resources that are invested in data collection. It is a reflection of the resources available to different agencies involved. Now, road safety information, just by the fact on the occurrence of injuries, is collected at different spots, right? There's data that's collected at the scene of the incident, at the scene of the crash, and that data will likely be collected by police data systems. If there's a death at the scene, that data will be captured in vital registration systems or health systems as well. But once there's if it's not a fatal injury, once a person is transported and makes contact with the health system, then that's captured in the health data sources, and eventually in the unfortunate circumstance, if that individual dies, most likely in many countries, the police don't have the resources or systems in place to follow up on that individual, and so it will not be captured in the police data systems. So the underreporting can occur because there's multiple different data sources, and different data sources capture different things. And many of our countries we haven't been able to develop systems that combine data from all these multiple different sources into one. That's one area through which underreporting occurs. Two is that we are not responding, or police may not be responding to all crashes that are happening, and therefore not all deaths are included in those systems. There's socio-cultural issues as well. In some of the countries, we have this culture of burying our dead quickly, as soon as possible. This notion that a death happened and that was by the will of God. So, for example, many pedestrian deaths in some countries are not captured because pedestrians die on the road. The families bury the dead quickly, and therefore these are not captured in any systems. So multiple different reasons why underreporting occurs. And what WHO does is it takes these numbers, takes the country situation, and using a modeling approach, tries to fill in those gaps. And that's why this huge discrepancy occurs. When the first report was released, the first global status report, many countries were really concerned with this underreporting, and they felt that the report was making them look really bad, and the situation in their countries wasn't bad. And when I said this can be an opportunity, an entry point for dialogue, what that did was it led to the beginning of a dialogue on, okay, what is underlying this discrepancy? Why is it that WHO is reporting such a high number and we're not reporting that high number? And it had the effect of bringing different stakeholders around the table to first talk about data systems. And then eventually those discussions led to what it is that we can do to enhance road safety and improve our numbers, whether it's reported numbers or those that WHO was reporting.
Great. Thanks for that, Abdul. And maybe, Fangdan, maybe I can throw it to you for another question. I think we've got someone asking around how many countries actually contributed to this report. I mean, that number probably changes for every report, but roughly an estimate.
Yes, that's actually one of my slides. So for this 2023 reports, it's 170 countries plus 2 territories, covering 97% of the global population.
Yes, and that's out of the 193 member states, isn't that correct? So
yeah,
that's great. And just for both Abdul and Fangdan then, I think, you know, we talked a bit about modal shift and different forms of transport coming into the system over time. We've got a question around, does the status report actually take into account some newer forms of transport, such as e-scooters? And if it's not already included, will it be included in the next version of the status report? Abdul, maybe a short answer from you.
Well, I'm not, I don't have the specific data. There's certainly information contained in the report that looks at e-bikes and, you know, data that different countries collect on e-bikes. As I mentioned in my presentation, that's significantly lacking. And there's only about 34 countries that report that they collect information on usage of these.
Excellent. Anything you would like to add to that? Yeah, Fangdan? Nope. Great. We've also, sorry, Fangdan, did you want to add something?
I think you pointed out an issue that's really emerging. Especially in our region, there are more use of e-bikes or e-scooters. So we're trying to look at this issue in more detail in the regional report. But as Abdul mentioned, the data is not quite sufficient because we pretty rely on the data we collected from the countries.
Yes, but given its increased use in a lot of countries, especially in the high-income countries, unfortunately, we probably will see an increased number of fatalities and injuries related to that in the next report as well. So,
and also in relation to that, WHO also does, in addition to the global status report, WHO does special efforts to look at the e-scooter safety through webinar involving many countries who are heavy users of e-scooters. So there are technical guidelines already, there are webinars already, in addition to the global status report.
Excellent, excellent. And I can see there's quite a few questions coming through. Unfortunately, we're not going to be able to answer them all, but I think there's quite a few that's actually related to PTW safety, which of course is a very topical issue at the moment, given the increased usage around the world and unfortunately the increasing fatality that corresponds to that. I think there's a question for you, Abdul. I think you mentioned about a PTW database in your presentation. And I think the question is around, is this an open database that is available to the public?
So my understanding is that all data that's collected by WHO is available upon request. I know, as Fangdan pointed out, there's different regional reports. So there's sub-analysis being done for this data. Some of the graphs I presented were from that analysis. So not published, but data that's available for looking into. So this data can be requested.
Fantastic. And just to close off this question and answer session, I just want to give Abdul and Fang Dan just an opportunity. So we talked a lot about data and the importance of data in helping to drive policy changes. So just a closing remark from each of you, a short closing remark from each of you. So what do you think are some of the key ways, I guess, the data in the report can be used by different stakeholders? We've got lots of different stakeholders on this webinar series. How can they use it and how they can use it to further action, how to, advocate for policy change? Your key recommendation.
I would say look at your country, or look at the country you're interested or country you're working in. Go to that app that Fang Dan mentioned, and that provides a really good snapshot of where the country is and a really good way of identifying what gap exists or what gaps exist, and from there utilize that information to prioritize action and drive political commitment.
Great answer. Thank you very much, Abdul. And Fang Dan, you get to have the last word.
Next time I try to speak first. Because I really think the same. So go to the country profile, and the country profile is actually color coded, similar to a traffic light system. So if you see any red light or a yellow light, that's where the gaps are. That's where we can focus our efforts on.
Fantastic. And with that, I want to thank Abdul and Fang Dan for your fantastic presentations. I've certainly learned a lot from you today, and I think judging from the comments coming through in the Q&A, there's been a lot of highlighting the fantastic presentations by you both. So on behalf of the group, thank you very much for your contribution today. And Mark, if you don't mind bringing up the last few slides so we can round up the session. So thank you everyone for your participation. Really appreciate all the questions that are coming through in the chat. And I'm very sorry that we're not able to go through and actually answer every single question, but thank you very much for your participation. There's been quite a few questions in the question box regarding the materials from this session. So all the materials from this session will be available at the APRSO Knowledge Hub. So just follow the link that's available on your screen and you'll be able to access all the material. And then if we move to the next slide. So today you've heard a little bit about what the WHO status report actually contains and how it can be used to help drive policy change and strategy development in your country. In the next session, which will be held in a couple of weeks' time, we're going to delve into what other additional and complementary data sources are actually available globally and in country that you can actually use to complement the WHO data to help with your strategy development and planning and action plan. So we would really love it if you're able to join us for that, and we hope to be able to see everyone there. And with that, we're just going to move to the last slide. And once again, I want to thank everyone for taking the time and participating in this session with us. Thank you very much to all our speakers today, and we hope to see you in a couple of weeks at the next session. Have a lovely week. Thank you.